Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Dr. Thomas Grove, you make me a happy man. How are you today?
Dr. Marc Darrow, you know what I'm doing over here. I'm living it up, Doc.
Hey, I don't know if you saw this yet, but we just got this beautiful review from a patient. I'm going to see if I can find it here because it's all about you, which is always nice. I'm looking quickly through my email. Oh, here it is, new Google review. 10 plus years of chronic lumbar pain, a microdiscectomy, that means pulling out the disc material surgically, and several PT and chiropractic treatments the last 2 years. Working with Dr. Grove in this office with stem cell and PRP treatments has significantly given me my mobility and strength to regain my quality of life again these last few months. Back to running, less frequent need to lie down after long stretches of sitting for work, and I can't believe it. Thank you endlessly and happy to return if more treatments are needed. So I'm not going to give out the name of this person. It's a great review, and I'm so grateful that you're here working with me, Dr. Grove. Can you comment on what do you think happened? I know you probably don't know who this patient is, but it's something we see every single day in our work, which is using what we call regenerative medicine instead of surgery. And regenerative medicine includes things like PRP, platelet-rich plasma. It includes stem cells, and that's basically how simple it is. It's just procedures that you walk in, you get injected, and you walk out. You don't even need anyone to drive you. I'm going to give out our phone number to the studio, then I'm going to have Dr. Grove pontificate on what he thinks went on here. So the phone number to the studio is 866-870-5752. And you can talk to Dr. Grove and myself, Dr. Marc Darrow, live and local right here. 866-870-5752. If you want to call the office, you're welcome to. There are people by the phones there. They'll give you a free phone consult. That's with our staff. And the number to our office is 800-300-9300. That's 800-300-9300. And then if you want to watch these injections, you go to our website. The website is absolutely prolific with not only videos of the procedures, you can watch them, but all of the information which is real about stem cells and PRP, platelet-rich plasma. And I say real because I'm told we do the most of anybody on the planet. Dr. Grove, we were looking at your stats. How many injections have you done the last few months? Do you remember?
Injections, I don't know. You're probably somewhere in like the 4,000 or 5,000 range because I think we did, 1,500 or something patients. I can't remember. But yeah, we're really busy. And just to comment on the review, that awesome patient left. It's just, we feel like we got the magic sauce. It's not super complicated, right? You have a patient with pain, and it's our job to figure out where that pain's coming from. And we say it every week, you can't get locked in on whatever your image tells you, right? So this is a patient who came in and they already had a back surgery, and guess what? They didn't get better, right? How many patients do we see like that, Doc, right? Failed back surgery.
Most. We see most, yeah.
And so why is that? Well, maybe the surgery isn't addressing the source of somebody's pain. So very important, guys, you're getting someone to put hands on you. If your physician's not putting hands on you and come up with a treatment plan, you're going to miss some things, right? And this is a patient who's a classic example of didn't need that surgery. The disc had nothing to do with what's going on. It's a ligament issue, right? You do a physical exam, throw the ultrasound on, and we see it's a ligament issue. We do some injections, they get better, no more surgery needed, end of story, right? Very common scenario that we see. Could talk hours for this. We already have a caller though, Doc. I don't know if you see this.
Well, I'm glad you saw that.
Let's grab him. We've got Eddie coming to us from Los Angeles. This is Dr. Thomas Grove, Dr. Marc Darrow. Eddie, how can we help you?
Hi, I was diagnosed with meniscus tear on my both knees, and I want to ask you about your stem cell therapy, if that would help the tear get better, or what do you think?
Well, first of all, I'm going to cut Dr. Grove off for 1 second. Almost everybody we see comes in with meniscal tears, okay? And
Okay.
I have bilateral medial meniscal tears, all right? Do I have
Right.
pain? Eddie, do you think I have pain?
Probably.
No, I don't. I did have pain, and I injected both of them. So on ultrasound, which we use, and Dr. Grove is probably the greatest expert on that in the country, we can actually see, and my knees, the meniscal tears have been healing up. The fibrocartilage that's in there, which is the meniscus, actually has grown back. So why don't you take this call, Dr. Grove, and give us your impression of what's going on with Eddie.
Yeah. First of all, do you have imaging that told you had a meniscus tear? Who told you that?
I had MRI done a few months ago.
Okay. Like Doc said, I mean, almost everybody that I scan has a meniscus tear that walks in the office, which I know is hard to believe, but I'm telling you, when you actually put the ultrasound on and you look at the tissue, there's a lot of people walking around with no pain who have meniscus tears. And there's tons of data nowadays looking at the outcomes having a meniscus surgery, right? That's really what we're looking at here. What are the treatment options? We can do nothing. You're still in pain. Typically that is not something that's going to heal up on its own. Maybe it will, maybe it won't. You can go with the injection route, right? You can do the traditional route, which is going to be things like steroids, things like numbing agents, which, again, we know this is bad stuff. It leads to a speeding up of arthritis. It actually kills off some of these chondrocytes, these cells that help regenerate and keep your own cartilage. So why would we want to do steroid injections nowadays? It's a head scratcher. Can't provide temporary relief, but we know it's not something that's going to help you heal. That's really the role that we're playing in people's lives, is we want to get in and try to heal that tissue, regenerate that tissue instead of operating on it. And then the surgery route is where you go in and do what we call a clean out surgery, which is where you go in with a little scope, right? You get a little bit of visualization of what's going on within the knee, and you actually trim out any meniscus that's not, looking 100% perfect, which sounds great, looks great in a picture. However, what we see is it speeds up people's arthritis, so they leave the operating room with more arthritis than they walked in with, and the knee is a little bit less stable because ligaments attached to that meniscus. So the big issue is, what sort of treatment route do we want to go? We're a little bit biased. We'd rather have something with less complication risk, higher degree of healing and pain relief in the long term, right? But a lot of people walk around with meniscus tears. Might even be the source of your pain. Every single week, I'm catching a diagnosis that somebody didn't know that they had, right? They walk in with one diagnosis, they leave with another. Why is that? Well, I'm using ultrasound. I can actually see in real time what that tissue looks like. I'm using my hands, I'm using my mouth, I'm using my ears. I want to make sure I'm putting my hands on the patient, listening to what they're telling me, right? And try to put a care plan together. Right? At the end of the day, we want to have a safe treatment plan for a patient. But for a meniscus tear, I would just strongly encourage you to look at other options before you consider something like surgery.
Eddie, do you have any questions about that?
No, but I would love to come and see Dr. Grove in his office, and hopefully. Perfect. Thank you so much for your help.
Yeah, and the phone number to the office, Eddie, is 800-300-9300. There's people by the phones now that will answer all your questions that we haven't answered, things you haven't thought of yet. And I want to give out the phone number to the studio again, which is 866-870-5800. 5752. That's 870-5752. And Eddie, any other pain in your body?
No, just mainly the knees are just pain come and go, but it's not, I mean, it's there, so.
Well, I hope you understand from what Dr. Grove told you that there is an amazing high probability that your pain is not coming from meniscal tears.
Great.
See, that's
Perfect,
something that most people, like, I don't know how old you are. How old are you, Eddie?
59.
Okay. So by 59, if you've been active in your life, then there's a good chance that you will have meniscal tears with pain or without pain.
Okay.
So what we often do is someone comes in, let's say their right knee hurts, okay? We'll take a look with the ultrasound, and we will not find a meniscal tear, all right? And then we always look at the other knee, and the left knee, which has no pain, we'll find a meniscal tear.
Oh, wow, okay.
Is this starting to make sense to you?
I know it's
No,
confusing. It sounds too good to believe, but I'm telling you, you can't buy in on what the imaging tells you, right? There's a lot of things that are not perfect on an image, but it doesn't mean you're necessarily going to be in pain, right? So it's a really, really important distinction that we've got to line up what you see on the image with what you're actually experiencing.
We like to get images. People say, well, Dr. Darrow, you don't like to get images. No, I like to get images. It's not necessarily to find a diagnosis, though, for the person, because
right.
I found at least 2 or 3 cancers by getting images. I'm grateful that the images were there. That's what I call a red herring. You know, a person came in for one thing, but it turned out to be something else. So, yeah, images are good, but they are overly used by doctors. My grandfather was a doctor born in the 1800s. He didn't have images. He used his hands to diagnose, and that's what we do. We use the images in conjunction with that so we don't miss anything. But the images can be, number one, they can be overly sensitive. MRIs can often show things that aren't even there.
Sure.
You know, we talk about this every show. ACL ruptures. You know what the ACL is? The anterior cruciate ligament in the knee?
Right.
People come in, they're maybe swollen in the knee, something like that. They had an MRI. It shows a anterior cruciate ligament ACL rupture, right?
Right.
They get a surgery. What happens? The surgeon says there's no rupture. So what happened? The MRI showed something that wasn't there. Don't get me wrong. I like MRIs, but we have to be careful how we use them. And what Dr. Grove does, he uses the ultrasound, which is live. And while he's looking, he can move the knee around or whatever body part he's looking at and see what's going on. And he uses the ultrasound to guide where the needle goes. So it goes to the right exact spot. It could be a micromillimeter that can't even be picked up by an MRI.
Sure. No, I really appreciate your show, and it's great. I'm very happy that I caught you listening to your show today. So,
oh, great, Eddie. I appreciate you too.
Make an appointment.
Yeah, and you know what you ought to do is to watch videos of the knee being injected or any other body part, go to the website, which is www.jointrehab.com. That's JOINTREHAB.com.
Okay, great idea. I will do
All right,
that.
Eddie, we love you. You know, the thing is, everybody who comes into our office gets our personal cell numbers. So I laugh and I tell people, I don't mind if you call me at 3 o'clock in the morning. And they go, I would never do that. And I go, no, do it. If you're up in pain, call me. Because I turn my phone off when I go to sleep.
I will do that. Thank you so much. Thank you.
All right. God bless you, man. It's great talking to you. We appreciate you.
Thank you very much.
All right. This is Dr. Thomas Grove and myself, Dr. Marc Darrow, on Living Pain Free. We're here to educate you on how you can heal your musculoskeletal pain without surgery. All right? Give us a call right now at 866-870-5752. We'd love to talk to you. That's 870-5752. Dr. Grove, I know you read studies every day, scientific studies. What do you think the percentage of failed orthopedic surgeries are for things like meniscal tears, rotator cuff tears, labral tears, joint replacements, back surgeries, neck surgeries, things like that?
When you're looking at studies and you're looking at things like surgical outcomes, the really important factor that you have to decide is like, what do you call a success, right? So to me, a failed surgery means, I came in with a symptom, I had the surgery, and is that symptom better, right? A lot of times with surgery, though, what we're looking at is something on an image, right? Something's torn or something's detached or something doesn't look normal. And then after the surgery, it looks different. So that's a surgical success, right? Now, the issue is that actually helping your symptom? Right. So, yeah, it depends on what surgery that you're looking at, but surgical failure rates are much, much, much higher than people understand. And again, sometimes it's just being off of that body part because you had surgery and now I got to be off of it for a couple of months. Like, oh, well, I feel better. Then they go back to using that tissue and, no surprise, that tissue didn't heal. We actually did more damage with that surgery. And when you're looking at outcomes from these studies, you want to track it, right, long term. I don't want to look at, 1 month after surgery. If I'm non-weight bearing on a joint that I did a surgery on, what you want to do is, hey, back when you're moving, right, the 1 year mark, right, 2 year, 3 year, 5 year mark, how are these people doing? And the success rates are just not very good. Unfortunately, we live in a very surgically driven culture in medicine. And we just find much higher success rates with what we're doing. Rather heal that tissue up instead of operating on it. Again, another classic example that I had this week of one diagnosis coming in, leaving with another. The guy came in with some finger pain and thought he had a little arthritis in there. And again, with ultrasound, I say it every week, the definition is so high with these devices nowadays. It's higher than MRI. So he ended up having a couple of things going on. So not only had a little arthritis, meaning he had a little wearing down of that cartilage, but he had some inflammation in the flexor and extensor tendons of that finger, right? These are the little pieces of tissue that allow you to kind of move that joint around like you're grabbing something. In addition to that, he had what we call some joint instability. It's another thing I'm very passionate about is if you're looking at even injections, making sure that you're doing a proper physical exam, make sure we're stressing that joint with your hands. And if things are a little bit extra stretchy, right, and you don't have as much stability to it, just because that might not cause pain necessarily, it might be accelerating the arthritis. So when you're looking at anatomy, you want to look at something called the functional unit. Basically, what's all that stuff that's around it that's causing potential pain, what leads to things being unstable. So for him, we did a couple of pokes around that finger, the joint. We did some of those collateral ligaments, right, those stabilizing ligaments on either side of the joint. In addition to those flexor and extensor tendons. One treatment, guy's good to go. So it's just something that we're very passionate about, making sure you're putting hands on your patient, making sure that you're listening to what they're telling you. Is it pain? Is it more that the joint feeling it's going to give out, right? How often is this affecting you? What medications are you taking? Your medical history, surgical history. You got to put all those things together, which is a challenge. That's why I think we get such great results with our patients.
Well, I'm fascinated. I've been doing this work over 27 years. I know you've been into it for a dozen or more years. And Dr. Grove and I, at the end of each day, we're doing like chest bumps. It's true. I mean, we laugh about all the, quote, miraculous healings that we see that really aren't miraculous. I mean, regenerative medicine is simple. You just take the cells from your body, the platelets or stem cells, and you replant them in the spot that needs to heal. And the success rate is just amazing. The morbidity is very low, meaning, what's the problems that people have? I mean, the main thing is just a little bit of stiffness afterwards. And, I personally, as most of our listeners know, had a shoulder surgery when I was in medical school. I was en route to becoming an orthopedic surgery, and I jumped in every orthopedic surgery I could get into. I'd call every surgeon in town begging them to let me come into surgery with them, and they loved it. So I hurt my shoulder weightlifting, doing a wide bench press, and my boss at the time took a look at it, and he gave me a couple steroid shots, which I didn't know were bad at the time, which made it feel great for a while. Then it would come back worse. And finally he said, let's do a surgery on it. And he did what's called a acromial decompression, which is, to me, one of the, excuse my French, the dumbest surgeries on the planet. He shaved down my acromion, which is the top bone on the shoulder, and cut a couple of very important ligaments. And I woke up with my arm swollen like a balloon and a high fever, and I was terrified. And it never really healed. It went for 4 years of me being sore, decreased range of motion. And then I learned about what was called prolotherapy, proliferative therapy, which back in the day was using things like sugar water that was concentrated, sodium moruate, which is a fish oil extract, zinc sulfate. And I tried all those things on my body at different times, but the first one I used was the concentrated dextrose, the classical prolotherapy. And it's a great story. Dr. Grove, I think you've heard it before. I came home with a syringe full of dextrose mixed with lidocaine. And my wife was lying in bed watching TV, and I got in bed with her, and I pulled out the syringe, and she started swearing at me, like, "What are you doing?" And I said, well, I had done this on my wrist, and it worked, from a golfing injury. Someone tried on my shoulder. And I woke up the next morning 100% completely pain-free in my shoulder. And it woke me up. At that point, I'm like, I'm not going to be an orthopedic surgeon. I want to be a prolotherapist. And the good news is prolotherapy has morphed over the years into much stronger types of solutions that can heal even better. So when I injured my knee years ago, I did the old dextrose prolotherapy because it's easy. I just get a bottle of dextrose, a bottle of lidocaine, injected myself. I had to do it 10 times, and I like to sprint, and each time I would sprint, my knee would loosen up again. And my patella, the round bone in front of my knee, was actually catching in the trochlear groove of the femur. So what I did next was I had my staff draw my blood, and I did one session of PRP, and it tightened up. Since then, I did a few sessions of stem cells too. And my knees are good. I had problems with both of my knees because I'm very active, and I overdo every sport, as probably every athlete does, and that's why they end up with us. But I've had good success. I've self-injected both my knees with stem cells and platelets, my right wrist, my elbows, both my shoulders. I've had other people do my neck and back. And every time, every body part I've worked on has come out wonderfully well. So I'm very grateful to be doing this work. I'm grateful that we have it in our office. And I know one of the staff told me you just injected your thumb?
Thumb, yeah. Again, had I just let this thing linger, right? I mean, I need my thumb. I inject with it every day, right? So, but I'm not going to live in a bubble, right? I mean, we're active guys. So again, I'm playing football on the beach, and I sprained my wrist and my thumb. Again, just put the ultrasound on it. You can see clear as day what's going on. Use a very small needle. And again, you guys, these are flu shot sized needles. I just did it to myself.
It's actually smaller than a flu shot.
No, it's so small. And again, when you have ultrasound, you can aim where you're putting that needle, right? One treatment, I'm good to go, man. I'm telling you, show up to work Monday, no pain, like it never happened, right? A little on the wrist, a little on the thumb, the collateral ligaments, a little bit in the joint. It's just, it sounds too good to be true, but as long as you know what the heck you're doing, you know what to look for, you're delivering these cells on target, being very specific now with that ultrasound, you can get great results with people. We just want to make sure we're letting you guys know sometimes you do need more than one treatment. Not everyone's the same. Your healing journey might be different than the next. I mean, Doc, you've had a couple different injections, right? Sometimes you need more than one, right? Sometimes it takes
my body. Oh yeah. I mean,
sometimes it takes more than a day, right? And so that journey is going to be something that I can't, take out my crystal ball and tell you, hey, what day are you going to feel better? Certainly. So it's one day at a time. Make sure you're staying off of that area that we inject. Take care of your body. Take care of your mind. Get good rest. Put yourself in a position to heal.
I just had an email question come in I want to give you because we just had 2 patients that came in that healed like that day and with the same issue. This question says lower back pain around the sacrum and neuropathy. Hang with us, Dr. Grove, and everybody listening to us, and we're going to get to some great questions and some great answers. Give us a call at the studio live right now, 866-870-5752, or call the office. Get a free consult with their staff. You get a free book when you call us, 800-300-9300. Hang with us. We're going to the break, and we'll be right back.